time. I'm so happy to see all of you here. If I can just have everyone's attention for a few minutes, we're going to have a quick presentation. So, good evening.
Good evening.
Hi, I'm Joe Alfano. I know many of you. If I have not met you yet, please come say hello to me. I want to meet you. Tonight is called A Toast to You, because that's what it is. It is a huge thank you to all of you, the supporters of Radiant Health Centers, who make our work possible every day. So I'd like to start tonight by saying thank you to you all, and to give you all a huge round of applause. So thank you all. We're also gathering today on December 1st, which is World AIDS Day. It's the day that we stop and reflect, think about the struggles, the battles we've had against this horrible disease, all of the strides we've made, how far we've come as a community, and it's also a moment to look ahead to where we're going and to the fight ahead to stop this epidemic once and for all. And you are doing that with your support. And today, it's also a day to stop and to reflect and to remember those who we've lost to AIDS-related illness. Behind me tonight, we have a beautiful tree, our remembrance tree, which has 100 red handmade cranes made by our own Sue DeRigo here from Radiant Health Center. So thank you, Sue. And there are tags on the table, and we encourage you to write the name of a family member, a friend, a loved one that you lost, and hang it on the tree and remember them tonight. I'd like to ask everyone to pause for one moment and have a brief moment of silence to remember those we've lost. Thank you for that. And I'd like to bring up someone you all know very well, our CEO, Phil Yeager.
Thank you, Joe. Welcome, everybody. And thank you for being here. Because of you, Radiant Health Centers has been able to grow and expand services to meet the needs of the community. Together, we can end the HIV epidemic, and we can do this with your support in allowing us to expand those services and programs that help us end the epidemic here in Orange County. Ending the epidemic is a holistic approach, and that's exactly what we do at Radiant Health Centers. We take into account the needs of our patients and clients, whether it be mental health services that individuals require, whether it be the wraparound support services, or healthcare equity that we are able to provide through our clinic. And all of these services are only possible because of the support from you all. This past year, your support has allowed us to expand those services to help us meet our vision of ending the HIV epidemic. And this is critically important. Thanks entirely to the private donations from individual donors such as yourself, we have been able to launch and pilot a youth services program this year. Under the guidance of our mental health department, they are leading this new program, addressing not only the mental health needs, but also the physical and social needs of the youth in our community who we know could benefit from our services. This year we also launched 2 new youth support groups, and we've also entered into an MOU with the City of Santa Ana to provide services to youth in the Santa Ana School District who may be struggling with their identity as an LGBTQ plus individual. So we're very, very happy to be working with the school on that program. But we're not stopping there. We will continue to expand and grow services. We will be starting more youth-focused support groups. We are also launching a gender-affirming boutique, as well as a mentorship program for youth. So stay tuned, you'll see a number of new youth programs rolled out in the coming year. The other exciting piece is the expansion to our medical clinic. And so right now, major renovations are currently underway on both our mental health clinic and our medical clinic at our site in Irvine. We're adding additional exam rooms and we'll be able to expand the number of patients that we're able to see. Those expansions and that renovation work should be done by mid-2023, so we look forward to hosting an event then and inviting you all back to see the newly remodeled clinic. We also continue our work towards becoming a federally qualified health center, which is an important part. And one of the most exciting things that we've done this year is we have hired a new medical director. Yes. Dr. Dewey has joined us as our medical director after serving at Vista Community Health Center in La Habra, as well as serving with Lestenac and also with Garza. Dr. Dewey brings passion for the work that we do, and we are thrilled to have him, and I'm even more thrilled to introduce him and let you all hear straight from Dr. Dewey. So please join me in welcoming Dr. Dewey Nguyen.
Thank you, Fred. Wow. I am so happy to be here right now with all of you. So honored and absolutely radiant to be able to celebrate, kick off this holiday season with you all and to celebrate your generosity and all your efforts to make Radiant what it is today. So I first wanted to publicly thank Phil. I don't think I've done this yet quite in this way, but Phil and I connected in March of this year, and when he offered me the job, I nearly turned it down because I thought there's no way that I could do this job. I was too inexperienced. I had just graduated fellowship 2-3 years ago, so I was too young and I had way too much to learn. But I slept on it, and spoiler alert, I realized that this is the job that I didn't know I wanted, and I didn't know what I needed. Being able to build a clinic from the ground up is a dream of mine. To be able to build a clinic where doctors won't be burning out, where people love going to work every day, and where we can provide excellent care to the patients. So thank you, Phil, for giving me this opportunity and for being here. Initially, I thought I could speak a little bit about what it means to be a gay doctor in Orange County. But I kept thinking back to patients and what it means to be an LGBT patient in Orange County. There are so many disparities that our community has to deal with. We smoke more, we drink more, we have more mental illness, we have more chronic diseases. And the chronic diseases that we have, they tend to be more severe. We also have a lot more mental illness as well. And that's partly due to the fact that our patients feel encumbered by the fear, by the constraint, the judgment, the rejection that they face every day. And I mean, it's not fair that we have to go online to a database that sometimes works to find an LGBT-affirming doctor. That's not fair, right? So here at Radiant, we are wanting to fix that. And the only way we can do that is with your support, with your generosity. Because of you all, we've been able to serve countless number of HIV patients over the past 3 years with compassion. And with the Giving Tuesday campaign that I think ended already, I'm not sure, but because of those funds, we're now able to buy a freezer to, to provide our patients vaccines, monkeypox vaccines, the flu vaccine for this winter season, HPV vaccines to help prevent anal cancer and throat cancer. And we can now buy a urine analyzer that can help us better detect urine infections. And I just can't believe I talked about anal cancer and urine infections right before dinner. But all joking aside, my dream for Radiant is to be the premier clinic, not just for the LGBT community, but for all underserved and vulnerable populations. In 1 year, we hope to become a federally qualified health center, which is a fancy term for a community clinic that never turns people away. It doesn't matter if they can't pay, they don't have insurance, if they're undocumented, we're going to take care of them, we're going to welcome them in, and we're going to do our best for them. So, in 5 years, I want to be the OC equivalent of LA's Gay Lesbian Center, Desert AIDS Project in Palm Springs, and we cannot do it without your help. So I wanted to bring up my clinic staff today because they are the people that make all this happen. It's just not a one-man job. So first I want to bring up Gabe. Where's Gabe? Gabe joined us 3 years ago as a medical assistant. And then through working with us, realized that Gabe could be an out and proud transgender person. So Gabe recently joined us again and is now an LVN. So congratulations. And then we have Matt Lopez, who is a drag queen by night. Shall I call her Summer Days? So please come up, Summer. Summer is that fiery spirit that lights up our clinic every day. So thank you, Summer. I also double as her publicity agent. So any event inquiries, please go through me. We also have Dr. Bonnie Bach. Dr. Bach, can you come up here, please? Dr. Bach has been fighting HIV for over 35 years. That is just amazing. And we're going to celebrate her retirement at the end of this year. So we're going to be very sad to see her go.
Well, I may stay around a little.
And then we have Dave, Dave, can you come up? Dave is our nurse practitioner. Oh, I'm sorry. Dave is our doctor of nurse practitioner. Dave graduated from TNP school just a couple months ago. Dave, congratulations. He is a workhorse, super efficient, probably more efficient than me. And then finally we have Luis Palacios. So I started with radio a couple months ago. Pretty young still, but I'm not the youngest person here. Luis is. Oh, here's Luis. Luis comes to Radiant from Yuba City, Northern California. He's a foodie, so please come up to him and give him all the OC restaurant recommendations. So this is our clinic team. And how amazing is it that when patients come to our clinic, they can see themselves in our staff. And that is something that you don't see at many clinics. And so before we get off the stage, Summer is going to tell us about a patient story.
Hello everyone, how are we doing tonight? Ooh, that's a little dead. Let's hear it. How are we doing? Yes, it's really lovely here. I am a drag queen. I am also a host I am a nurse. I am so grateful that I get to use my license as a nurse to help my community. And being here for like the past 2 years has been such an honor and a privilege because I get to see so many people come in and change their life. And it's amazing. And I find it so beautiful because I see patients like me where I was scared to get tested. And I was scared to do all of this. And then I did it, and then I got educated, and I was like, wow, like that's crazy. But I get to help those patients, and I get to educate them. And so it's such an honor and a privilege. And because of you guys, I get to do that. So thank you so much. And thank you, Dr. Dewey.
All right, thank you. It's funny, I've worked here for 2 years, and I don't think I've seen the entire clinic staff together before. So this is amazing. This is an amazing thing to have happening here tonight. Next, I'd like to bring up someone who is such a powerhouse on our board and is the chair of our client advisory committee, who is going to speak a little bit and introduce you to Fernando Martinez, who we're going to be recognizing tonight, also a member of our client advisory committee. So please welcome to the stage Daniel G. Garza.
Thank you. Everybody, I'm Daniel G. Garza, as the chair of the Client Advisory Committee. I have the honor and the privilege to be the chair. It is such a responsibility, such an honor to be the face of the clients. I've been a client of Radiant Health Centers for 13 years now, so I go back to when it was AIDS Services Foundation. So it's really exciting to see all the growth and all the new faces. And as an anal cancer survivor, I'm so glad that somebody else is talking about anal stuff now. So thank you, Dr. Dewey. Let's talk about more butt stuff out here. More so to the donors and to the staff and to the board and to everybody who donates time on behalf of the clients, because that's the privilege that I have. On behalf of the clients, thank you. There's not enough thank yous. There's not enough gracias for all the work that you do, for all the money, for all the time. I get to see it in our meetings once a month, the way that we grow and the services. And we talk about you all the time in our meetings. So again, gracias. Thank you so much for all the work that you do. I would not be the man that I am today in advocacy and personally if it wasn't for the services that I receive at Radiant Health Center. So I'm very grateful for that. But that's not why I'm here tonight. I'm here because one of the cool things that we get to do at the Client Advisory Committee is we get to work on ourselves. Clients don't just come for a meeting, we get to grow, and this year we work on our bios and we work on headshots and we work on building our confidence up. Because it's not just about physical, it's about mental, it's about spiritual. So part of my job is to make sure that spiritually our clients are up there and working hard. And one of the people in our community that works really hard, and it's why I'm so honored to be introducing him. Fernando Martinez, during the lockdown, was in charge of connecting with people. He would call people, he would Zoom with people, he would make sure people got their services. He's driven people, he's taking people back and forth. He's done all kinds of stuff to make sure that clients do what they need. Little do you know that we have a large number of monolingual clients, and sometimes they need somebody to translate, and when they needed somebody, they could call this guy. Now, I'm going to apologize ahead of time, because this is how smart I am. I decided to leave the speech in English on my phone, and my phone is recording right now, so I can't get to it. So, yeah, I'm not that smart. So please, do not judge his speech on my translation, because it's a lot better than I might do it. But let me bring up to the stage Fernando Martinez. They have it. We're sitting. But now I don't have my glasses, so yes! They actually work.
Hola, buenas noches a todos. Mi nombre es Fernando Martínez. soy cliente y miembro del CAC en Radiant Care Center. También soy miembro del Concilio en la Clínica 17 y del CAC. Soy miembro activo desde 2016. Estoy orgulloso de ser un abogado activista y investigador en 2 países. Yo nací en León, Guanajuato, México. Me vine a vivir a los Estados Unidos en el 2010. Yo fui diagnosticado con HIV en el año 2000, cuando vivía en México, y fui parte de un grupo de apoyo a mujeres indígenas y demás población, en especial a las mujeres indígenas que fueron abandonadas por sus esposos después de haber recibido el diagnóstico de ser positivas en VIH.
My name is Fernando Martinez. I am a client and a member of the Client Advisory Committee at Radiant Health Centers. I'm also a member of the 17th Clinic Council and Client Advisory Committee there. I have been an active member since 2016 and proud to be an advocate, activist, and an instigator in 2 countries. I was born in León, Guanajuato, Mexico, and moved to the United States in 2010. I was diagnosed with HIV in 2000 while still living in Mexico and was part of an advocacy group that supported indigenous women that were left by their husbands after receiving an HIV diagnosis.
Al ser diagnosticado positivo en HIV, comencé mi tratamiento en el CAPACIT, que es una organización federal que da servicio a las personas que vivimos con VIH. Yo fui testigo de cómo esta institución daba servicios a personas extranjeras que vivían en México y los atendían de la misma manera que a los nacionales.
We're working for an organization called CAPACIT, a federal government organization that helped those living with HIV and in need of services. I was witness to the passing of 3 foreigners that lived in Mexico and received the same treatment as Mexican nationals.
La primera persona a quien yo le dije mi diagnóstico de positivo con VIH fue a mi pareja. En ese momento teníamos 16 años de relación y pensé que en ese momento era el fin de la relación. Pero su respuesta fue abrazarme y me dijo, somos pareja y no estás solo y solo la muerte nos separará. Y así fue hasta que falleció en 2016 y con el estatus negativo.
The first person I disclosed my diagnosis to was my partner. We had been together for 16 years and I thought our relationship was over. He hugged me and told me that we were a couple and only death would separate us. He passed away in 2016 with an HIV negative status.
El siguiente paso fue reunir a mi familia e informarles del diagnóstico, esperando lo peor. Porque la vergüenza y el estigma eran muy difíciles en México. Pero mi sorpresa más agradable fue que toda mi familia me abrazó y inmediatamente se pusieron a investigar los diferentes pasos para conocer cuál era el desarrollo del VIH y conocer así como ayudar para mi tratamiento.
I'm going to read what I have. When I was diagnosed, I weighed about 83 pounds, couldn't walk and wanted to end my life. I heard a doctor say to a nurse, just give me an aspirin, and then I surely would not survive the night. During my attempt, my brother showed up and stopped me. I gathered all my family to inform them of my diagnosis, expecting the worst because of stigma and shame. I was surprised that my family embraced me and began to do their own research to better understand HIV and help me in any way that they can.
El COVID me hizo pensar cómo la comunidad latina en ese momento éramos casi solos y para pedir ayuda y decidir estar con todos ellos, muchos de internacionales y gente latina, estábamos completamente aislados.
I'm going to go back as I skip a part. I decided to be an active member of the HIV community because of the lack of services, compassion, and dignity in Mexico. During a visit to the AIDS Services Foundation, I was asked if I would like to be more involved in the community. COVID taught me how the Latin community can be left out and dismissed when it comes to services. I decided to keep the community connected with phone calls, visits, when possible, and accessing information for those that were isolated.
Mi gratitud a Radiant Care Center por protegerme y hacerme parte de la comunidad en la cual me siento integrado, respetado y que me da la fuerza para contar mi historia y tomar una plataforma para compartir mis conocimientos y mi experiencia con otros de mi misma comunidad. Mi meta es vivir sin miedo, crecer y ayudar a otros a lograrlo. También mi sueño es vivir abiertamente, libre, sin estigma y que mis compañeros junto conmigo vivamos nuestras vidas auténticamente. ¿Lo termino? Yo les digo a mis compañeros, hay que vivir una vida manteniéndonos indetectables y seguir los pasos necesarios que nuestros proveedores de salud nos dan. Seguir todos los cuidados médicos y cuidar la salud mental, física y espiritual. Ojalá y todos mis compañeros me sigan y lleguemos a una vida más armoniosa.
And the last part is, I am grateful to Radiant Health Centers for giving me a community where I feel valued, respected, and have found the courage to share my story. I've been given a platform to share my knowledge, wisdom, and experience with others. My goal is to live fearlessly, to stay grounded, and to help grow the community that we have built and see others use it like I have. My dream is to live my life open and free and show others how to live their authentic lives. To others in the community, I say to live a good life, stay undetectable by following doctor's recommendations, stick to your medical regimen, take care of your mental, physical, and spiritual health, and above all, fight for your life.
Thank you, everybody.
So, we did this because Fernando's first language obviously is Spanish, but he does speak English. So I'm going to encourage y'all to please stop him, say hi, hear more of the story. This is just one page. I got the privilege to sit with him for an hour, and we had to reduce it for a minute. But stop him, listen to the story, because the time, the money, the effort, and the heart that you give to Radiant Health Centers, we receive that. So thank you very much.
Thank you, Daniel. And thank you, Fernando, for sharing your story tonight. Appreciate you being here. Okay. Thank you all. We still have a great evening ahead. We have a full dinner for you. So that's coming up now. At 9:30, the Disneyland fireworks show, weather permitting, will happen. So we'll be able to watch that here from the rooftop. And before I leave, I just want to say, this is the time of year when all nonprofits, Radiant and all the others that we support, are out, trying to make their goals to meet the year so that we can continue to serve people like Fernando and to support our clinic staff and to support all the great work that we're doing. We're very fortunate here at Radiant. We have a wonderful anonymous donor who has put up a $50,000 match for our year end. I wish I could tell you their name, but we'll send our love through the air and out to them tonight. We're at 61% of our goal. We have till December 31st to make our goal. Many of you have already donated, and if you have, thank you. You have made a huge impact. Some of you maybe haven't made your gift yet. If you haven't, we can help you tonight. We have some fantastic pride ornaments behind us for a donation tonight. We'd be happy to share one with you. Any donation will help and will go towards our year-end goal. So thank you so much. Please help us out if you're able to tonight. Please enjoy your evening, and I look forward to having a little more time with you all tonight. Thank you. Enjoy your evening.